quickly, let's go over IV needles, okay? So this is from BD. This is a 24 gauge. This is probably one of the smaller IV sets. It's yellow. It's always going to be yellow, okay? These are particularly good for elderly patients, smaller patients like your neonates and your children. This is good. This is, you know, you'll feel a small pinch, but these are good for like general, like IVs for them. Next, we have a 22 gauge, which is blue. It's always going to be blue, okay? These are good, again, for your older patients, your smaller patients. Sometimes in certain hospitals, these are okay to run blood transfusions through, but this is good for regular IV fluids, IV piggyback of medications. These are good as well. Next, we have 20 gauge. Now, these are generally like the hot ticket items here. This is normally what people go for when they put IVs in. But this is good for, again, blood transfusions, IV antibiotics, IV fluids. When you go down to get a CAT scan and they want to put IV contrast in, this is what they're asking for, a 20 gauge. It's pink. It's always going to be pink. All right. Last but certainly not least, we have an 18 gauge. Now these 18 gauges could be used for the same thing as the others are used for, but they're also good for, again, blood transfusions, IV infusions of blood, fluids, medication. These, and along with like your 14 to 16 gauge needles, which is much bigger, will be used for like trauma. When you go down to surgery, sometimes when they knock you out, they'll put one of these in while you're sleeping, okay? Because it is a bigger needle. It's green. It's always going to be green. And that is it. Bye.